Today, our government is pleased to announce we are investing $2.7 million over 3 years to launch a new mobile crisis response team to serve Barrie and the surrounding area. This is one of the over 100 mobile crisis response teams our government has launched across the province, pairing healthcare professionals with police or ambulance responders to respond to crisis situations, to ensure those experiencing a mental health and addictions crisis are connected to the support they need. This mobile crisis response team, known as the Community Alternative Response Engagement, or CARE, is expected to launch later this year. The CARE team will operate as a partnership between the Barrie Police Services, the County of Simcoe, Simcoe County Paramedic Services, CMHA, Simcoe County, and the City of Barrie, and will enable community paramedicine and mental health crisis workers to work with the Barrie Police Service to deliver immediate mental health and addiction support to vulnerable people in your community. The CARE team will also provide options for ongoing care, including referrals to connect people to ongoing care, transportation to treatment facilities or safe locations, such as a treatment withdrawal management facility, CMHA Simcoe County, in-home mobile withdrawal management services, or a safe bed, and follow-up care that will be provided within 72 hours of an intervention, including arranging an ambulance if a visit to a hospital emergency department is required. The CARE team is one of 3 innovative pilot programs our government is launching that uses creativity and collaboration through mobile crisis response teams to expand access to specialized addiction care in community. Investing in targeted services like mobile crisis response teams is one more way our government continues to break down barriers to mental health and addiction care in communities across Ontario, connecting thousands of people across the province to the care and support they need where and when they need it. Thank you again to all the partners who have come together to make the CARE Mobile Crisis Team a reality, and for your ongoing work to deliver world-class care and support. I look forward to our continued collaboration to better support people on their journey to recovery and wellness. I will now pass it over to Associate Minister Tibolo to share a few words. Thank you. Stay well.
Thank you, Minister, and good morning, everyone. It is truly a pleasure for me to be here this morning with my colleagues, Minister Jones and Minister Downey, for this very important announcement. It's no secret that Barrie and its surrounding communities have faced significant challenges with mental health and addictions over the last few years. Today's announcement is about demonstrating that as a government, we're taking these challenges seriously and putting our money where our mouth is. We know that people struggling with mental health and addictions have a better outcome when they're treated close to home. We have evidence that supports this, and we know that this is what needs to be done. We also know that a critical part of getting someone the help they need is earning their trust. And that process begins with how we interact with those individuals, particularly if they are in crisis. Low barrier access is extremely important to build that trust with the individual. And in Ontario as a province, and working with our municipal governments, we've all agreed that specialized crisis response teams that include first responders and healthcare and mental health care workers are the way forward. It's an important and welcome development that I'm extremely proud of. The work that I've done in the past, the work that I do, is ensuring that we build a continuum of care in the communities to support individuals, as was said, where and when they need that help. It's rare that in politics and government to find everyone working together and agreeing on the course that we need to follow. And in this case, I'm extremely proud of the fact that so many community organizations, so many people that are delivering supports and services understand and see the importance of collaboration and building these systems of care in the community. Over the last few years, between the Ministry of Health and the Solicitor General's office, we've invested tens of millions of dollars to stand up mobile crisis response teams across the province. And today, we're continuing that progress with the CARE team here in Simcoe County. This innovative new model of paramedic-led teams is designed to build relationships and therapeutic alliances that help vulnerable people know that they have allies and supporters who know them and are there to provide them the care that they need. By providing on-site interventions and supports at home or within the community, this new CARE team will ensure that people are getting the right care when and where they need it most. By diverting people with mental health and addictions challenges away from emergency rooms and keeping police out on patrol where they should be, this team is going to be and will give clear and measurable impacts on the delivery of care in the city of Barrie and across Simcoe County. I want to end by thanking the Mayor, all of the first responders, all of the partner agencies involved in getting this team off the ground and making today a possibility. A special thank you for the first responders that continue to put their lives on the line each and every day to keep all of us safe. We hear you, and we are here to provide you the tools that you need to be able to do not just the job, but a much better job making the lives of everyone in Ontario better. There are challenges, and we know that we need to work together to solve those challenges, and I'm so happy that we're utilizing an evidence-based, community-focused system that will make a difference in the lives of so many people. And this collaboration is a collaboration that is being watched by many other municipalities and regions because, again, with that collaboration, we're able to deliver much better services to everyone. And with that, I'd like to say thank you once again for all of you, for the support that you've given, and I look forward to coming back and celebrating the successes of this model.
As a police organization, our members are committed to helping others during the worst experiences of their lives. Today's announcement highlights the importance of all of our agencies working together to support our community, and especially those who are experiencing mental health and addiction crises. We want to ensure that those individuals in crisis receive the most effective and efficient response. However, we also know that often the presence of a police officer, despite their genuine desire to help, may escalate an already difficult situation. Our data shows that many of the highest users of police services are low-harm individuals with intersecting challenges of homelessness, addiction, and mental illness. In providing non-police, specialized medical response to these types of calls for service, the CARE team is working to provide the most effective response. The CARE team in Barrie is based on similar models in other communities across Canada and the United States, which have seen significant success. While the team is made up of specially trained paramedic and CMHA crisis intervention worker, the Barrie Police Service is proud to support the team through our communication center. Our communication center will provide call taking and dispatch services to assist the CARE team, and as always, police will respond to any situation that poses a risk to individual or public safety. I'd like to thank our partners at the County of Simcoe Paramedic Services and the Canadian Mental Health Association, Simcoe County Branch, for being so open and enthusiastic about this new approach. And of course, thank you to the Ministry of Health for their support and contributions. Working together with our partners, we are proud to be part of this research-driven approach to provide an innovative service to our community.